Welcome to the Beverly Hills Plastic Surgery Podcast. Dr. J. Calvert. Dr. Rovelo, how are you?
I'm doing well. How are you?
Nice to have you here on a Friday afternoon podcast session.
Yeah, I'm a little disoriented.
I know, we snuck out of the office to do this. It was like, we could do it from 1 to 3. There's a little gap.
I know. And then I got to go right back.
I know. Well, it's okay. We'll do it. I did a little surgery this morning, a little patients this afternoon. Life is good.
It's good. It's a little field trip.
And we're talking about flying in for plastic surgery.
Yes. So this actually, I'm surprised we haven't done this podcast yet because it is something that we encounter with our patients. We love to have patients that fly in for their plastic surgery that have found us and chosen to come and make the effort and fly in. But the circumstances are a little different for those patients. And there are some things that it's important that they know about the whole process.
Yeah, the reason people come to Southern California for plastic surgery is because we do a lot of it here, and we're pretty good at it. And It's not that they're not good elsewhere, but some people just want to kind of go where they're doing a lot.
Right. Or if, they're looking for a certain look or something like that. So all kinds of reasons, but for whatever reason they have chosen to fly in to have plastic surgery away from their home base.
Right. So how do you do that? The first thing you do is you contact the office of the surgeon that you want to have surgery with. So oftentimes people will call me and say, hey, I need a facelift, or I need a revision rhinoplasty or a primary rhinoplasty, and I get a lot of this too, a lot of, complex reconstructive, breast implant work. And they say, how long do I need to stay? That's always the first question. And my answer to that is, well, where do you live? Because it's different depending if you live in Las Vegas, Chicago, New York, London, or Kazakhstan.
Right. And where you live, but also what surgery you're having makes a big difference. So I get a lot of these for complex revision breast patients. And the answer for them is different than for a facelift patient. So I think it's probably best if we break it down by procedures, because then that will help patients understand more or less what they need to do. But at its most basic, as you mentioned, you'll call the doctor's office or reach out on the website or whoever you contact them and start the process and say, this is what I'm interested in. And then there are a couple different ways of going about initiating that first meeting with the doctor. I'm totally okay doing a virtual meeting. I request patients send in photos ahead of time, ahead of the virtual meeting, so that I can review them. And then we meet on camera and we discuss their issues, and we can go through their photos and talk about what their best plan or option is. Of course, if they want to come in person, they could do that too. But I usually start with a virtual meeting. Um, if they do decide they want to proceed with surgery, my personal preference is to see them in person before going to surgery. And I would prefer to do that not like the day before, but maybe like at least a month before, because I just like to get a good physical exam. And that's just me. I feel more comfortable making a plan when I've actually evaluated the patient in person.
Yeah, I mean, with my nasal surgery, I really prefer to see them in person long before we're doing the operation. The show up the day before is possible in some instances. It's not impossible. If I can get a CT scan and I can look at them and they don't have like complex airway stuff and they haven't had lots and lots of surgery, then I'm usually okay with the CT scan, talking to them and asking them questions on a Zoom call or whatever, or FaceTime, whatever. I can do the assessment, I can make a plan, and then I always say, look, I haven't examined you, so that plan is subject to change. You'll come the day before, I'll look at you and confirm it. I can honestly say that I've never changed the plan.
Right.
So the ones that I'm comfortable with, I can do. I do need to see them the day before, do a full physical exam and be ready, but I've never had that problem. And I've always said there's always a chance you come here and there's something that's going to nuke the whole deal. That can happen from somebody driving from, San Bernardino County also.
Right. And for me, for my part, it's mostly breast and body stuff. And so I do need to examine the tissues. If I'm ordering implants, I need to kind of know what size I'm ordering before the day before. Maybe I need to put mesh, and I don't know that until I've looked at their skin quality.
You ain't meshing around there.
I am not meshing around.
Yeah, I got that.
And same thing with the body patients. Maybe, once I start looking at their skin and touching it. I'm like, "Oh, maybe you'd be better with a circumferential incision." Like, these are all things that I don't want to be surprised the day before and have to rearrange the whole amount of time I have in the OR, or I don't have the devices that I need. And certainly the last thing I want is for the patient to come and I'm like, "Ooh, I need to do a little bit more than we talked about," and then maybe they can't afford that, and then they cancel the surgery. Like, there's all these things that I just from my personal state of being, I prefer to see them at least a month ahead of time. That way, if we have to change plans, we have the time to do so and we're not canceling last minute. So, what I do not recommend for anyone out there is meeting your surgeon on the day of surgery. And there are places
Oh my
that
God.
do that. And I would just seriously question what kind of place you're going to. I hate to say that because I know people that do that
They
and
do.
they're perfectly respectable surgeons, but I don't know.
It's not for me.
I don't love it. Maybe that's just the OCD part
Yes.
of me. I like being prepared.
Typically, you wanna have had enough interaction, and if you haven't had, obviously before going to surgery, you're going to do a physical exam. It should be at least the day before, but, that's where for me, if I have a CT scan and I can look at their nose, know their history, I can do the rhinoplasties that way. Facelifts, I wanna see the patient. Do I have to? No, the day before I can do that too. I mean, it's kind of obvious what needs to happen with facial rejuvenation surgery. Complex breast operations, though, that's really challenging because depending on the quality of the tissues, like, you don't know whether you need to
Yeah.
have a mesh or
And you don't
I
get
just assume that I do. So if I'm not gonna see them, they're coming from, Halifax, or Greenland or something like that, then I'm going to just say, "All right, but when you get here, you need to come the day before, and let's really hash out." And I plan for the worst, and then if it's easier, that's great, but if we know that we're planning for the worst, then it's fine.
right.
And then the big question is, how long do you stay? Well, for me, if you're if you're west of the Mississippi, we can discuss a little bit about how long you need to be there, if it's 10 days or 2 weeks. If you're east of the Mississippi, then usually I want 2 weeks of you to be out here. 10 days would be short for any operation, especially facelifts, especially noses, because things can happen in that, 10, 11, 12, 13, 14th day after surgery that I don't wanna have to call my buddies in,
Right.
Boston and say which I've had to do, and, sometimes, people have problems 5, 6, 7 weeks after surgery that, lo and behold, I gotta jump on the phone with somebody and say, "Hey, can you lend me a hand here?" And, they usually do, but it's not their responsibility to do that.
Right.
I think if you fly in for surgery, one thing you have to be prepared for is at sort of a moment's notice, you may have to get back on a plane and fly back and see us. I'm sorry, that is just the way it
Absolutely.
is.
You have to prepare for that. And hopefully that doesn't become an issue. You can keep your regularly scheduled follow-ups, but you have to plan that if something goes wrong, and things can always go wrong. It's surgery. There are no guarantees. If something goes wrong, just plan on coming back and seeing your surgeon because there's nothing more disconcerting and stressful for the patient and the surgeon than trying to manage what could be a complex complication virtually. Like, it's just really hard.
Yeah,
And if you need another surgery or you need something addressed, like, it's just better to see your surgeon, especially in that early time period.
100%.
And my recommendations for how long a patient needs to stay are probably a little bit longer, but again, it depends on what surgery you're having. So, what I would say is, if you're having a complex breast surgery, there's a strong chance that I'm using mesh. There's a strong chance that I'm putting in drains. And I want you to stay in the area as long as you have those drains in place. And I don't know how long those drains are going to stay in place. Sometimes it's a week, sometimes it's 2 weeks. Worst case scenario, it's 3 weeks. But I want you to stay in the area and then whenever I remove the drains, I want you to stay for another week because I'm going to check you in a week and make sure fluid hasn't reaccumulated, that you're not having any more problems before I give you the all clear to get on a plane and fly home. So that could be 3 weeks. That could be a little while. I don't love the idea of you traveling and getting on a plane and hauling all of your luggage, even if you have someone to help you. Just the act of moving around as much as you need to get to the airport, get through security, get on a
Yeah,
plane, walk to your car. That's a lot of movement during a time when I really ask most of my patients to just stay home and not
hold
move
still.
and hold still. So that's the complex breast patients. The body patients is probably even longer if I'm doing
For
a
sure.
really big body case because those drains in a big body case can stay in 3 weeks easy, and then I still wanna see you a week afterwards. So I tell him, "Plan on being here maybe a month." Now, if you're just a small, little tiny tummy tuck, I don't really need to put any drains in, a week or 2. But again, factor in how much movement you're gonna be doing during the actual travel process, because you shouldn't be doing a whole day's worth of travel 2 weeks after surgery.
True. The one caveat to my 10 days to 2 weeks, and I like 3 for the faces, is people that live in a 5-hour driving
Mhm.
radius of
Yeah.
Los Angeles, like in San Francisco or Reno or Vegas or San Diego or Phoenix. I'm okay with them kind of hanging out for a couple of days, especially for the primary rhinoplasties. So some revision rhinoplasties, I'll say, sure, you can go home and recover at home and then fly back to get your splint off. And they say, oh, I can fly right away. I said, I had a guy leave the Cedars Sinai recovery room and go to the airport and fly to Seattle. So evidently you can.
Definitely
I,
can.
I, I think you'll be okay. You might ooze on everybody, might bleed all over everybody, but
Your
all right.
sinuses might explode,
Yeah,
but
that's
other than
okay.
that,
Well, they're pressurized cabins unless you're taking like a Cessna single engine, single prop Cessna at 12,000 feet. But the reality is that those people, I'm kind of okay with them not having to hang around LA, because the truth is, if they really need to get back, there's probably a
they can come.
Southwest flight that can leaves in the next 45 minutes that they can jump on and get back to me. Or, it's just not that far away that it's a problem. But complications happen, bleeding, early infections, seromas, pain, things, you get whacked in the nose by, the family dog. Like,
Right.
these things come up that if you were here, they probably wouldn't happen. So, it's good to just, pick a hotel or get an Airbnb
Yeah.
or a VRBO and just hang out and stay close, because we're like somebody's in the office all the time. We have people around. If I'm at a meeting, then you're there. If you're not there, then our fellows are around. Or there's
Other
we have
doctors, there's
all of our
always
doctors. There's
someone.
always
Yeah.
somebody there. Our amazing PAs who've been there forever. So you always have help when you're here. When you're at home in Scottsdale after having a complex revision rhinoplasty, yeah, there's a reason you came from Scottsdale to have that
Options
complex
options are limited.
revision rhinoplasty, and
Yeah.
and those people don't the people that
Yeah.
didn't do it don't wanna see you.
No, you didn't pay them. Like, they have no
No,
reason to see you.
like, why would I wanna take care of
No.
that disaster that,
Right.
you went to
Right.
Beverly Hills to, Jay Calvert who does this. Like, no,
I
you
don't
didn't come to me in the first place.
Yeah.
That's why, so go away. And that is the
Right.
truth. So when you fly in, you should plan on, like, socking in and focusing on being a great patient and getting it done right.
Yeah, just a little side note on that too, because I'm sure you get them. I know I get them. I'll get patients that did have surgery elsewhere, usually south of the border, and something will be going wrong. And they all of a sudden need to see a plastic surgeon. And it's not like an emergency necessarily. Maybe they don't need to go to the ER, but there's some redness, maybe there's some drainage they're concerned about, or the scars aren't looking quite right. And they'll call and be like, oh, well, I'll pay her consult fee. I just want to see her. But it's like, it's not about the money. It's that I didn't do your surgery and I don't know what happened. And I don't want to have responsibility for what could happen next
Yeah, when you don't know where you're coming
when I
in.
didn't do your so there is that. So you have to sort of know that, like, even if you are home and you're in a city that maybe has lots of plastic surgeons, they may or may not be, like, super open to helping you
I'm fine with
if
it.
they didn't do a
It's
surgery.
$15,000. So
Yes.
I will see those patients, but they have to pay basically for a revision surgery fee, because I don't want the liability of what
Right.
was done elsewhere. I don't know what the conditions were.
Right.
Like, if it's done in the United States and my friend did it in New Jersey and that patient is out here,
Your friend, you know what
I
happened.
know they
Yeah.
were in a certified facility that has, all kinds of, spore tests and infection control, and I know that operation was done in a proper manner. I don't know what happened in, Mexicali. Like, I don't know what the standards are there, I don't know who that surgeon was, and I don't know, if you only paid $4,000 for it, then, why are you looking at me to, like, take care of it at this point? You need to get back on the road. Go back
Yes.
to your surgeon because they know what they did, and that's the best person to take care of you when you're having trouble, not, jumping into some other office. So, like, if you're gonna travel for plastic surgery, you've gotta go back to your surgeon. It is the right move. It's part of the deal. It is your responsibility as the patient to understand that you need to do that. You have to
Right.
do your follow-up.
Yes.
It's in the paperwork. I
Mhm.
guarantee it, even in Mexicali, it's in the paperwork. I guarantee it.
Yeah, I'm sure it is. And usually once patients are out of sort of that early post-operative window and they're home, I'm not gonna have them come back for the usual time frame of follow-ups. Like, my usual time frame is 6 weeks and then 3 months, 6 months, a year, assuming there are no issues in between. I'm not gonna ask that schedule of my patients that don't live here, but I would really love it if you could come back, say, at 3 months, and 6 months and a year, I'll leave that up to you, but, uh, it's it'd be nice. It
Yeah.
would be nice if you could come back for some long-term follow-ups just so we can see if there's any issue. Sometimes patients don't always recognize if there's a problem or an issue that needs to be addressed, or I just I like to see patients.
Yeah.
I wanna see them, I wanna see if there are any issues, and it would be nice if you could come back.
I think it's not it would be nice. I think it's like you gotta do that. You gotta come back. I mean, I do tell them I wanna see them, but I'll see them by Zoom, and if they're doing great and it's
Yeah,
the problem is there are things that don't come through
on camera.
video chat.
No.
It's not 3D. We don't have the, like, Star Wars holographic examination ability just yet. I mean, I'm sure it's
I'm sure
coming.
it's
I'm sure it's
coming.
very soon. I can't see why not,
Well, they
you know?
reach through the screen and,
Yeah,
like, touch your
exactly, like,
nose.
that'll be, that'll be interesting. Yeah, that has other applications, I think,
Ooh.
that, like anyway, but back to what we were talking about actual follow-up. Follow-up has to happen. It is your responsibility, the patient. If you don't do it says in the paperwork, you are expected to do this it's your responsibility. You wanna get great results, follow-up's part of it. I
Right.
mean, I just, was talking about a patient that, she had, like, problems with her scalp wounds from her brow lift, and it was, like, all gnarly, and she's like, "When are you coming out here?" And I'm like, "I don't have a license there."
It's not how
And I was like,
that
"No, no, 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 no. Eh, back on the plane, you have to come back out here." "That's not happening. I can't do that." And I was like, "But that's your responsibility, like, you're having a problem." So I call my friends in her city, and they're like, "Yeah, it's, you just need to close it back up." Like, "Can you do it?" "No, I'm not touching that with a 10-foot pole. You do it." I was like, "Well, send her back." They're like, I just can't get there." So I go, "Well, it'll heal eventually." It all does. If anybody, understands, wounds will eventually heal some way, shape, or form or whatever. And when she can get here, I can help her with it. But the reality is if you're signing up for out-of-town surgery, you're gonna fly in, make sure you have your bases covered, you got the dogs taken care of while you're out of town, like, somebody's gonna feed the kids and clothe
Right.
them. All that stuff needs to be handled so that you can go and have a very focused experience and
Right.
be a great patient, and that is what will get you the best results possible.
Yes, have a plan. Ideally, have a person who can at least fly back with you. They may not necessarily need to come with you, but if you're going back pretty early, you want someone to help you with the travels and the suitcases and all of that stuff. Talk to the offices. The offices usually have good ideas about where best to stay for long term. We have aftercare facilities for the first night or two. We have some local hotels that you can stay in for as long as you want. Airbnbs in the area are good for longer term stays. So the offices are a pretty good resource in terms of, assisting you while you're here. But yeah, flying in definitely can be done. Patients are very happy, but there is a little bit more work and stuff they have to do on their end.
Yeah, and it's worth it. I mean, you get I mean, go with the surgeon that you think's gonna
Right.
knock it out of the park for you. That's the truth. I mean, I have a lot of friends who have fly-in practices all around the country, and they manage to do it in a way that they get it done and get it done right, and it's safe and it's effective. I mean, anything can happen, but you want to stack the cards in your favor to get the best results possible, and that's you follow these guidelines we're talking about, you're going to get it.
Absolutely.
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.